In Canada, the term mental health has certainly surged over the past 5 years. Addressing this issue is not a straightforward process because people have vastly different interpretations of the mental illness spectrum. But if I can make one generalization on the topic, I would say that virtually all Canadians have either personally dealt with or know someone who struggled with mental health issues since 2020. I think this is fairly well documented, but I disagree with the widely accepted belief that stigma is the main obstacle to that type of healthcare in Canada. Indeed, politicians in the Great White North made many empty promises in terms of healthcare as of late. While Canadians were encouraged to bang their pots and pans to recognize healthcare workers, those same workers dealt with chronic underfunding, understaffed hospitals, and much more patients. For example, the Government of Ontario passed Bill 124 in 2019 that would limit wage increases to 1% for registered nurses, nurse practitioners, and other healthcare professionals. Despite the fact that COVID 19 was declared a pandemic in March 2020, the only reason this law was changed, over 2.5 years later, was that the courts found the law to be unconstitutional. Mind you, this was reportedly the worst global health crisis in the past century, yet attracting and retaining healthcare workers was apparently not a priority. The president of the Ontario Nurses Association said that from 2018 to 2024, for every 10 nurses this government say have been hired, 6 have left. Although it's not my usual type of content, the goal here is to explore some of the common challenges in seeking mental health treatment in Canada. Unfortunately, some of my friends took their own lives over the past few years, and it's not easy to talk about these type of topics. Just as an example, I bet that you didn't know that in 2023, about 1 in 6 Canadians received a prescription for antidepressants. The problem is that those numbers vary significantly. Women are twice as likely to have used antidepressants in Canada, 22% versus 11%, and the province also matters, with Newfoundland and Labrador having the highest prevalence at 1 in 4 people, and 1 in 3 women in that province received a prescription for antidepressants in 2023. I made an editorial choice to use a narrative based format, and I will be talking about uncomfortable topics. Unfortunately, suicide is the second leading cause of death in Canada amongst 15 to 34-year-olds. Women are 3 times more likely to attempt it, but 3 out of 4 people who take their own life are men. Most presentations on mental health don't show these numbers, but I find them difficult to ignore, especially since, on average, 12 people commit suicide in Canada every day. My story is mostly derived from experiences in Ontario's healthcare system. However, these problems are common to many parts of Canada, and the lessons learned are hopefully useful to people in other countries as well. This is Facing a New Reality, a commentary on mental health in Canada. On March 11, 2020, the World Health Organization declared COVID 19 to be a global pandemic. At the time, I was doing my MBA at the University of Ottawa, and a British professor of mine broke down the situation quite accurately. He stated, "The WHO announced that we have a global pandemic on our hands, and many of my European colleagues told me that all classes have been moved online. It's likely that U Ottawa will follow suit shortly, and we will have to make changes to adapt to this new situation." That was an understatement, as it certainly took more than 2 weeks to address this problem. Ironically, it was very possible that I contracted the coronavirus on the weekend of March 7th, only a few days prior. I went to an event called O Town Showdown 2020, and I noticed some of the participants were wearing masks, which stood out at the time. I would find out approximately a year and a half later that these people were apparently nurses and their partners from another city who knew they had COVID 19, but didn't want the money they spent on tickets to go to waste. So they showed up and wore low quality face masks instead. If this is true, there's no question that it would be the perfect environment for COVID 19 to spread. The Glebe Community Center was absolutely packed with hundreds of people, and dancers bumped into each other for hours that Saturday night. I called the city of Ottawa to get a testing kit, but at the time they were reserved for people who were hospitalized or in a dangerous medical condition. That made sense to me, and even now I question the efficiency of the tests that were available at the time. It was 2020 and we were very much in the early stages. Regardless, I had the symptoms and I was told that the classes would be online for an undetermined amount of time. In the background of all this, I had my own house and two lovely roommates. I was planning on selling my house in the spring of 2020, and I had mentioned it to them sometime in February. So I offered them a financial incentive to shorten the notice period required, just so I could renovate the rooms and not have to work around them. The plan for me was to live on my own again, probably in a one-bedroom apartment, and regain some of my personal space. I was 27 and looking forward to live on my own again. By mid August 2020, things were looking up for me. I had sold my house, gotten my first car, and met a lovely lady. I was even looking at buying a house. I had 3 weeks off between finishing my classes and going back to work full time, and I truly made the effort to enjoy nature, take advantage of downtown Ottawa, and hang out with my friends when they were available. By December 1st, I moved into the new house that I bought, and I was quite happy despite the chaos surrounding the pandemic. Then I saw the bedbugs.